Are your glutes the bad guys, or is there something deeper going on with the nerve? Many people are told they have piriformis syndrome when they're actually dealing with sciatica. Or maybe it's the other way around. Today we're going to show you 4 tests you can do at home to help figure out sciatica versus piriformis syndrome and what to do next. Let's go. This is the seated piriformis test. You're going to sit tall, place one of your ankles over the opposing foot, press down and lean forward, normally stretching the glutes, but if this lights up the glutes or side of the hip, it may be because of the piriformis. But here's the catch, it doesn't rule out sciatica. Let's move on to the next test. The next test we're going to do is called Slump Test. You're going to tuck your chin in and around your back like a teenager on a laptop, and then extend one leg straight. If this causes pain shooting down the leg or increases tingling sensation, that's nerve pain. Piriformis doesn't usually cause that type of sensation. It usually compresses, not stretches the nerve. To see if the piriformis is angry, I can test it directly. I can do the seated or side lying, doing an active contraction of the muscle. I can simply place my foot forward and push my heel into the ground, squeezing my glute. I can also lie on my side, place my legs in a clamshell position, and rotate out my hip to squeeze the thigh against the wall. That squeezing of the glute, if it causes pain, it could be because of an inflamed piriformis muscle. Now this doesn't rule out sciatica, but it does give more credence that the piriformis is involved. Next, Belt's test is one of my favorite tests to do in office. It's simple and we're going to modify it for home use. You're going to have the patient looking forward, simply reach down unsupported and trying to touch their toes, usually causing pain, and coming back up. You make note of how painful that was. Now I'm going to use my hands to support my pelvis or hold my belt tightly, or better yet, try and bring your lower body against a wall to support the hips and the legs, and then flex forward a second time. If you notice the pain is actually worse when your pelvis is supported, it's because your spine's doing more of the work. And that may be a sign, especially if it's electric or tingling, that's coming from the sciatica. If it's easier to bend when your hips are supported, that may be a sign that there's more problems in the hips, possibly piriformis syndrome, possibly sacroiliitis. Add all these tests up to get a better clinical picture, but one factor alone usually isn't enough. So now you know, piriformis syndrome is often tight, achy, localized, while sciatica often follows a pattern, being irritated and made worse by stretching and certain spinal movements. If you found this video helpful, please drop a comment or a question below, and check out our full YouTube library to help fix sciatica fast. And we have PDF links below that show all of our different routines and extra help.